Coming up on this episode of Common Denominator.
I have wives who tell me, like, don't let my husband come in the room because I don't want them to see that I'm missing a tooth. It's so heartbreaking. And so it's nice to have that skill to be able to restore their smile and change their smile.
Hi, and welcome to Common Denominator, where we focus on human connection and what brings us together. I'm Moshe Popack, and today, practical steps we can take for a brighter smile and whiter teeth. My guest is Dr. Desiree Yazdan, a prolific cosmetic dentist who sees patients from all over the world. According to a recent survey by Snow Teeth Whitening, 57% of Americans cover their mouths when they laugh because they're insecure about their teeth. And 1 in 2 Americans always try to smile with their mouth closed. If you're one of those people, Dr. Yazdan is here to tell you that you don't have to live like that anymore. She has expert advice on what you can do at home and what dentists like her can do in the office to improve your teeth, improve your smile, and improve your confidence. Before we play the interview, a quick reminder that if you like the show, please subscribe and follow me on social media at @mpopack. Now, get ready to smile because here's my conversation with Dr. Yazdan. Enjoy. Welcome, Desiree, and thank you for joining Common Denominator.
Thanks for having me. I'm really happy to speak with you.
Super fascinating recently that I just found out about oral hygiene and teeth, that it actually, if you don't take care of your teeth, it can actually have an effect on your heart condition, potential dementia. Tell us a little bit about that.
Yeah, so there's certain bacterial strains that can live in the mouth, and as they proliferate, meaning like as they grow, they cause different types of diseases. So if you're not cleaning your teeth properly, you're not seeing your dentist regularly or getting your teeth cleaned by a hygienist regularly, as that bacteria grows, it actually goes it can go through your entire body and travel through different parts of your body. Can even cause heart problems. And then there's even been things linked to dementia that if you are not cleaning your teeth properly, can contribute. I wouldn't say it's the only factor, but it can definitely contribute to different forms of dementia, which is so crazy to think about how everything really is connected. And I think people know now that everything's connected, but they don't put it together, right? They're just, I think for some people, they aren't exposed at a young enough age to how important it is to keep your teeth clean and keep your teeth healthy. And if you just don't get in the habit at a young age, when you're older, there's already so many problems that you have with your teeth that either people are embarrassed to get the help that they need, or it's so expensive for them. And so the neglect just continues. And it's like they know they need to get it done, but they don't because of just where they're at, and it hasn't been a habit.
Yeah,
so it's really learn that at a young age.
Yeah, no, I realizing that, seeing that that's the case. My dentist is actually here in Coral Gables, and he's constantly, whoever has, for instance, his thing is whoever has metals in their teeth, he changes it out. He says that the metals, because we're electric frequency. Again, I'm a layperson when it comes to dental procedure, but he likes to change it out. That's his thing. He's a holistic dentist, so he goes ahead and he changes out, and he says because it definitely affects the electromagnetic fields of you as a human. So that's
with the silver fillings, there's a lot of mercury that could be released, yeah. And that's happening as people are like, oh, it happens when you remove them, but it's happening on a daily basis as you're clenching, eating, grinding your teeth. Some level of that mercury they've found is being released into your body. So I'm a fan of changing those out as well.
Yeah, and I think of it, I think I'm flossing, brushing my teeth twice a day. And why do I actually have to go to the dentist? So what is, just for the general layperson to understand the difference between getting cleanings and getting checked out, and maybe it's even 2-3 times a year, even if you have a good cleaning regimen, why should you still go to the dentist?
I'm so glad you asked that. Okay, so first of all, I love that you said 2 or 3 times a year because sometimes people think, oh, I just have to get my teeth cleaned every 6 months. And that's usually great for somebody who, up until 25, 26, 27, maybe. And of course, there are people who are older that can get away with every 6 months. But most people, as they hit the age of like 29, 30, they have a level of bone loss and some level of gum recession in some way where they need to get cleanings more often, maybe 3 times a year, even sometimes 4 times a year. And so the 2 times a year that's so commonly known is not right for everyone. It is right for some, but it's not right for everyone. So that's one thing. You need to know how your body is and what works best for your body. Like, so for example, I'm really young, I'm really healthy, but since I want to say literally 28 or 29 years old, I've had to get my teeth cleaned every 3 months because just of the way that my plaque builds up and I'm a dentist. I have access to all the best dental care, all the best tools. I have like an incredibly ridiculous oral hygiene routine that if you watched, you would be like, this person would never have any bacteria in her mouth. But I have to get my teeth professionally cleaned every 3 months because if I don't, then I can tell that, there's like buildup that builds up that I'm not able to clean with just floss and the products that I use, like a Waterpik water flosser, my electric toothbrush, like all the things. I mean, thank God I do all those things, right? But the way the hygienists work with their tools, first of all, the tools take off things that your floss and your toothbrush just can't do. And then on top of that, they're examining your teeth, looking for things that happen because you can't see what's happening in the back of your mouth or in your top teeth or any of that, right? Like you could see your front teeth, but you can't see if you're starting to get areas of decay or breaking your teeth or wearing them down. And so you really need to have that checked out and just really understand what's happening with your body. And you need to have your dentist do an exam regularly as well for the same reasons. Like you need to have x-rays done. People are like, oh my gosh, the radiation in the x-rays is so bad. But it's like there's more radiation from your cell phone than the x-rays. But at least the x-rays are telling you what's happening with your body. And it's not that you have to have those done every 6 months or every, those you let your dentist decide how often they want to do it, but they are for a reason. They're checking for, cysts in your bone, infections that you can't necessarily feel, but that are there, right? People think, oh, if I have a cavity, I could feel it. My tooth would be sensitive. That's not always true. So a lot of times by the time you can feel it, it's like progressed and it's really deep and you need more treatment than just a filling or whatever. So, it's all
that's really interesting. I'll tell you what was interesting is the fact, because I also think about that a lot, is that, there's radiation, right? But the fact that there's more radiation with cell phone use, and we use that all day, every day.
Yeah.
Right. But I don't know, any types of radiation is no good. Right.
Right. I agree. And it's just like the AirPods with the Bluetooth. It's like right by your brain. Right. Like,
which I don't use, by the way. I'm not a fan of AirPods. It doesn't make any sense. And, wires are better.
I'm the same way. My husband's like, you're so old school. He's like, let me buy you AirPods. I'm like, no. I'm good with the wires. But yeah, and I mean, I don't even have my cell phone on me most of the day, on my body. But most people do, and they don't realize, right? But then it's like they're worried about a couple x-rays, but it's like you need the x-rays.
And you should put your cell phone when you sleep out of the bedroom, actually, because that's just even for radiation perspective and also for privacy. Because even though people don't know this, even though your cell phone seems to be off, it's actually recording everything you're saying or doing. Most people don't know that. So
yeah, that's why you see the ads for all the things that you think about.
That's exactly
on
right.
Your phone. But yeah, I mean, I always think of if I get on my phone first thing in the morning, that's if I get on Instagram or whatever it is, it's like I'm inviting everybody who's following me into my house with me in the morning. And I'm like, yeah, no, I just want to have some privacy. So that's one thing. And I agree with you. I sleep with it. I sleep with it close, in my bedroom, but on the other side, and it actually does affect your sleep. I don't know if you've noticed, but
Completely.
If your phone is next to you, you probably don't sleep as well as if you put it on the other side of the room.
Yeah. My wife always says, that she just has to have it available in case of emergency.
I get that.
Right.
You have 10 kids. Like
right.
when my kids are older, for sure, it's going to be like glued to my head when I'm sleeping. Because if they need to get a hold of me,
For sure,
that's going to happen.
And I'll tell you something. You talk about your routine. It's very familiar. My wife, she probably spends 20 to 30 minutes on her routine. Again, the floss picks, the electric toothbrush. I mean, everything top to bottom. I barely have any cavities, right? And then she has tons, and a few of my kids also have tons, and actually the ones that actually eat well. So my question is it kind of like genetic, the cavity thing, or is it actually the sugars and garbage that you eat?
It's both for sure. So there is a genetic component of what enzymes are in your saliva that can contribute to, neutralizing the pH in your mouth and breaking down the food particles and all of that. So there's a component there. And there's also the component of how well you take care of your teeth. You can have the best genetics, but if you're just, eating sticky foods all the time that are, sugars and sticky foods that are lowering the pH in your mouth, then, and you're not taking care of your teeth, then you are going to get, decay and all of that. So it is really important to, like, the environmental aspect of it, taking care of your teeth is really, really important. Of course, if your genetics are more favorable, then you're set up for more success, but you still have to keep up with it, right? It's like people that are naturally thin, right? They're like, oh, I don't have to work out, but it's like, but you might still have to, because even though you're thin genetically, like, you can still gain weight if you're just like eating garbage all the time, or like you might not be healthy. You might not have, you might have like high blood pressure or high cholesterol or something like that, right? So it's like you still might need to eat healthy and exercise just to remain healthy, right? So,
Yeah,
kind of the important thing to know is that you really should. It is both.
yeah. That's which I didn't fully realize. I was like, oh, they just you always told as a kid is like you eat sugar, you're gonna get cavities. But yeah, that's an interesting point. And I think about I was making a joke with my dentist that he should set up a chair in my house because it's each mouth 32 teeth, 10
Yeah.
kids, my wife and I 12, so it's 33, 20, I don't know, almost 400 teeth, right? So some of them have cavity issues plus cleanings. It's either my wife and I are at the dentist either once or twice every single week. It's like that plus the doctor, right? Imagine that system. So going to kids, how can we motivate kids on their own as they're kids and as they become into their adult life about good oral hygiene? What are kind of practical tips?
Really think the education and probably exposure to it at a really young age. Like, even my daughter, I know she has really bad enamel. Her enamel's really porous. She's going to be 3 in like a week. And so, like, ever since she was little, I've made brushing a very important part of her routine. So just getting her used to it and explaining to her, like, in kid terms of like, there's sugar bugs and they can eat your teeth and we want to get the sugar bugs out. And like, a lot of times she's like, I don't want to brush my teeth, and she'll cover her mouth. And I'm like, oh my gosh, did you have pineapples today? I see pineapples in your teeth. Let's get it out. Right. Or just make it like a fun thing, not like a big scary thing. And then as they get older, just keep educating them on why it's important and why you should keep up with it.
And by the way, I wanna go back to that point where you said, and because I really love that about the discipline, that you can have somebody. And I was just speaking to a friend of mine. I train Brazilian Jiu-Jitsu and martial arts, and he said he would rather be around somebody that has that discipline, the daily discipline, than someone that's kind of like an X factor, above everybody else, because they're reliable, sustainable. That's what in life. That's what I want listeners to understand that point. I'm very glad that you brought that out, because that in life, in practical life, and that's the reason we're trying to give practical advice here in the podcast. And practically, right, if you have and you set up the discipline, no matter how you feel good, you feel bad, it doesn't matter. but you're creating that muscle memory of
Totally.
good things, doing good things. The results will come slow and steady. So thank you.
Totally.
So thank you for bringing that out. If you're just joining us, you're listening to the Common Denominator podcast. My guest this week is cosmetic dentist Dr. Desiree Yazdan, who's delivering expert advice on how to achieve that $1 million smile without spending $1 million. Next week, I'll chat with Candy Valentino, a real estate investor, entrepreneur, and the host of the hit podcast, Generation Wealth. We'll discuss the real estate market, how to build and scale a business, and other ways to generate life-changing wealth. Make sure to subscribe so you don't miss it. Now, back to the show. And something also that always just pops in my head, I always think about, I don't know, maybe it was 10 or 20 years ago when it came out kind of like with the whitening strips. Do you recommend, and I know some people go to the dentist to get their teeth whitened. Is there pros and cons to do it at home? Does it make a difference?
So it does make a difference. So if you go to a dental office, you're getting a prescription strength bleach. You're getting your tissues isolated properly, so there's no contamination by the saliva, and also you reduce the risk of your tissues burning from the bleach. And so you're getting a more effective result. And, strips, like whitening strips that are over the counter, they're not a prescription strength bleach. They do get contaminated by the saliva. Do they work? Yeah, they can work. It takes longer to see results from that, but they can work. But I always think I always go to the professionals for things, right? Like if I'm going to dye my hair, I don't really dye my hair myself. I go to someone to do it for me because I just want it to look, right. I don't want to I'm not an expert in dyeing my hair. So I don't want to just buy an over the counter box. I know a lot of people do. I'm just saying for me, that's just how I am. If I'm getting a cake for my daughter's birthday, I don't want to bake it because I'm not good at baking. I don't make things look pretty. And I want someone who's specialized in that, who's doing it every day to make the cake for my daughter's birthday. Right. So it's just with your health and your teeth, it's important to see your doctor. I think the strips are good as a in between office whitening to maintain it a little bit. I don't think it's good for doing an actual treatment of I want my teeth to be super white. Let me do this. Teeth whitening is one of those things where if you want your teeth to be white, you should keep up with it throughout your life, because let's say you don't whiten for 5 or 6 or 7 years. If you look in the mirror and you're my teeth are kind of yellow and I want them to be whiter, you're now at a different baseline than you were 5 years ago. So if you want whiter teeth, it's important to just start now wherever you're at, because this is the whitest your teeth are ever going to be able to get. And sometimes patients will be I don't want them to be too white. And I'm they'll only get as white as they naturally will get. They're not going to get a scary white, that it's your natural teeth. So they can only get so white. Right. So I think just seeing your dentist regularly and talking to them about your goals is really important. But over-the-counter strips are good, like I said, in between to just maintain a whiter smile between whitenings and stuff if you want.
And does it ruin your teeth? Does whitening, I heard that rumor, kind of does it actually chip away at the enamel of the teeth?
No, it's no surface staining. As long as it's done properly, or as long as you're following directions or getting it done with your dentist, then it doesn't ruin your teeth.
So I know your main area is cosmetic dentistry. So what are some of the stories of your most proud moments of because it seems like people will have tremendous anxiety sometimes. And I heard a stat that over 50% don't even show their teeth when they're taking pictures. So what are some of the stories, maybe one or two that really stick out in your mind of people that you've really been able to help that really made a difference and impact on your life?
Yeah. So what I find is many of my patients that come in, they are so uncomfortable in their own skin. They don't, like you said, they don't show their teeth when they smile. They hide their teeth when they smile. They're embarrassed of their smile. They even lack confidence. And what's sad is, so I take before pictures before I'm doing their teeth. And I have to ask them to smile because we want to see how their lips fall, and we design the teeth for them. So there's a lot that goes into it. And it's they like every single one of them, they don't even know how to smile. They're just like, it's like awkward for them. And they're like, I don't really smile. Like, I don't know what I'm supposed to do with my lips. Like, what do you mean? And because I'll be like, show your teeth. And like, that's not your natural smile. You can tell it's like a smile that they've like created. It's not a natural smile. And it's like so hard for them to smile. And especially with like a camera in their face, right? It's like, they are so uncomfortable with it. And it breaks my heart because I see like moms who like, they're like, I just want to smile in my kid's birthday photo this year. And I'm like, that's like such a thing that a lot of people take for granted that just have nicer teeth, right? Like they don't even think about that. And for like this person, it's like a daily thing. I've had patients tell me that during COVID, they were so happy that like there was a mask mandate because they're like, I could finally like be out in public without like hiding my smile and thinking about my smile because I just knew it was covered. And I was like,
Wow.
oh my God, that's like so heartbreaking.
Yeah.
Right. And so for me to have the skill and the talent to be able to change that for somebody, to relieve them of that mental energy that they're spending every single day, multiple times throughout the day, like thinking about their teeth, hiding their teeth, worrying about their teeth, like insecure in a job interview or like in a picture with their family, right? Like I have wives who tell me like, don't let my husband like come in the room because I want to make sure like, I don't want them to see that I'm missing a tooth. And it's like, they hide like a missing tooth from their spouse, or their children or like, and it's so heartbreaking. And so it's nice to have that skill to be able to restore their smile and change their smile to the point where like they come in and they hug me and they cry. They're like, somebody told me I had pretty teeth. And it's like, for a lot of people, it's like, that might be a common thing that they hear like, oh, you have such a pretty smile, right? But for these people, it's like, they've never heard it for 30, 40, 50 years of their life. They've been insecure about their teeth. And now all of a sudden they're like, people told me I have nice teeth. Like, and it's so heartwarming to hear like, oh my God, look at, and they want to show you their pictures of how they're smiling now and their pictures with their kids and their families. And like, they're like, yeah, like even my spouse knows that I'm so much happier and all these things. And I love that part of it. I think that's really what keeps me going. Like I could put veneers on anybody. But though it's the ones that like really have had that emotional struggle that I could take that emotional pain from them away. That really is what keeps me going.
I think that's fantastic. In other words, being the conduit, the vessel to undo people's trauma. And it's just made there in their head, and you could do that. That's super fulfilling and rewarding, for sure.
Had a friend who she's always been in such good shape, and she even did like these fitness competitions. And after she had both of her kids, she told me, she's like, oh, I'm getting a mommy makeover, I'm getting a tummy tuck, and like all these things, right? And it's like, during her pregnancy, I forgot what she had, but it created like loose skin and like a loose muscle in her stomach and all of that. And so she had her mommy makeover. And when I went to visit her, I was like, so how do you feel? She's like, oh my gosh, I don't have to think about it anymore. I don't have to think about what I'm eating all day long or what clothes I'm going to wear to like hide my stomach or what. And she's like, I just can be present with my family now, or I can just like be present with what I'm doing. I'm not like in the back of my mind, it's not spinning that I have to think about like hiding my body or whatever, or what clothes I'm going to wear, or how it's going to look. And I was like, wow, it's the same concept of like how I do things, right? It's like, just it's like giving them freedom to actually like live their life.
Well, we had a guest, Dr. Miami, plastic surgeon here in Miami, and he also had that tremendous gratitude to see the difference of people, again, from their physical body and watching them transform, and just their whole energy changing. And that was like his crux. It's funny because I know also how, the backstory. I guess you had braces 3 times, how originally you got into the dental space. So I had braces, and I also had to have Invisalign. So a little bit familiar. That was probably at the forefront. Is that kind of the catalyst of what got you into the space?
Yeah, I think I was just exposed to so much dentistry when I was younger. I had like my front two teeth were flared to the side, and they were like, I had spaces everywhere. And so like, thankfully my parents put braces on me. And then I ended up having them 3 times just because of the way that it was done. And as I aged and all of that. And I'll tell you what, like my teeth still are not aligned how I would want them to be aligned, but it's what it's going to be for now. But it really was a big deal because it's like, even when I was in second grade, I remember like people made fun of the space between my 2 front teeth where they would be like, oh, it looks like you could fit a train through there. And I'd be like, what? Like when I look at it now, I'm like, why would somebody say that? But like people would, like kids at school would like make fun of me for my teeth. And then I'll say that once I got older, it was just even, I unfortunately do have bad genetics for teeth. Like I mentioned, I have to get my teeth cleaned every 3 months. Growing up, I had tons of cavities, despite the fact that I always had good oral hygiene habits. It's not something that I lacked. I'll say probably I had more sugar in my diet back then, so I did have more decay, but I still was flossing and brushing every single day, all the times that I needed to. And so I was exposed to a lot of dentistry at a young age. And then I think that I just liked it because it's like, I like working with my hands and doing like tiny projects. And that's kind of what dentistry is. It's like very creative and it's an art and of course a science as well. And I love science-based stuff. So it just feels like the perfect career for me.
And I know also you have a podcast, The Social Dentist.
Yeah.
Tell us the mission statement of your show.
Yeah. So my show is different. It's not about dentistry, but it's basically to help other doctors grow their businesses by use of marketing and social media and all that. So I unfortunately went through a really bad business experience where I had a business partner who then, she had the practice for many, many years and it was super successful. And I bought into it thinking that this was going to be a great partnership. And she basically sold the practice knowing that she had a lot of skeletons in her closet. And basically the practice died. And so everything that I invested in died along with it. Sorry. And I was like fresh out of dental school, maybe like a year out of dental school. And so it was at the beginning of my career and I was like, oh my God, like I'm really in this hole. And so the only way that I was able to save myself was I started marketing on social media because I had no money to actually pay for marketing. And if you don't have patients coming in your door, then you're not going to survive. Right. So I started marketing on social media and my Instagram account really started to grow and my Facebook started to grow. And so I started getting a lot of patients. And then I really understood how important marketing was for a business. And I learned how you have to do it as a doctor because there's a lot of people that sell on social that, they're selling like essential oils or like soaps and lipsticks. And it's like, $10 products. But as a healthcare professional, you're selling treatments that are thousands of dollars. So basically that is to help other doctors grow their businesses with their marketing. And I also give a lot of like business help and advice on there for them as well. So yeah, it's called The Social Dentist.
So I tell you something, 2 things, because I always love this, people that take from their life experience and pay it forward. So you had this, everyone says, oh, when you're in it, and I always look at the things in my life that was like seemingly at the time the worst things in my life and end up being the best things in my life. And I want to commend you for that. That, in other words, paying it forward for other people. And the same thing, you had kind of a funky experience as a child with your own oral hygiene. And then this is what you do. Right? So people, it's like, it's always the thing that we kind of either we run away from or we embrace is actually our passion and our meaning and our purpose. And I also want to ask you, like, I always ask the guests, and it's sometimes it's hard. What's the kind of the number one thing that stays in the forefront of your mind that you're grateful for?
Oh, does it have to be related to dentistry?
No, whatever comes to your mind, instinct.
Yeah, my instinct is honestly health. Like my health, the health of my husband, my parents, my mother-in-law, my like brother, his family, my kids, like all of that. That's like, even like my dog, I always am so thankful for our health because I know that life can change in an instant and you might not have your health for whatever reason, or you might be diagnosed with something and not have your health. And so like every day I'm just like, I'm so glad, like no matter how bad something can be in a day, I'm like, you know what, at the end of the day, my kids are home, they're healthy, my husband's healthy, I'm healthy, my family's healthy. Like there's not much more I can ask for. Like life's 50-50, 50% of the time I'm going to feel great. 50% of the time I might not feel so great, and that's okay. So
Yeah, my grandfather used to say that to me. As long as you're winning more than you're losing, you're doing amazing, right? So it's like 51-49. And what is, and it could be anything, what's something about you that that nobody else knows or people don't know?
So something people really don't know about me is I have a lot of like, I don't know the term for it. I was going to say like desires, but I guess I do a lot more than just like dentistry and whatever. Like you said you train Brazilian Jiu-Jitsu. I also train Brazilian Jiu-Jitsu.
Wow. There you go.
And I think I'm probably not as advanced as you, but I am a blue belt.
There you go. No. That's most people drop out by now. So yeah.
I actually trained at the Gracie Academy.
Sure.
Headquarters. And so I love their method, and I know that like, you know, the grandfather and all that, I know the whole history of everything. So I'm really into jiu-jitsu. I am really into like racing cars. I have a car that I race on a racetrack. I haven't gone in a long time, but like it was something that I used to do. So there's like a lot of things about me like that most people wouldn't expect. I'm actually really good at playing the piano. It's like a skill that I've developed since I was 5 years old. So there's like a lot of things that I do, that people might not see, but like that I have created a skill for myself for. And I like having I like a lot of things that I can do.
Yeah. I want to tell it also to the audience is about work hard, play hard, because if you don't have that reward for yourself, it's, it's, you always have to have that reward. And, but tell me, how can people find out more about you and follow you on social?
So my social handle is at Dr. Yazdan, DRYAZDAN. I have the Social Dentist podcast, of course, for any doctors who are listening who are interested in getting help in their business. I have my coaching practice is full, but I coach women in the evening, like women doctors with their practices, and help them grow their practices. So that's really cool. So if they're interested in that, they can always reach out or join my email list, dryazdan.com/email. So those are the ways that you can get in contact with me. Instagram is always a good one.
Well, thank you so much. Super informative. Great to have you. Thank you so much.
Thank you. It was so nice to talk with you. Thanks for having me.
Hope you enjoyed my conversation with Dr. Yazdan. Next week, I'll speak with real estate investor, author, and entrepreneur, Candy Valentino. We'll discuss why the time is now to engage in the real estate market, how to build and scale a business, and other ways to create generational wealth. Please subscribe to the show so you don't miss an episode, and follow me on social media at Popack. Have a great day, and I'll talk to you soon.